we have been taking some measures to prepare, and we're mobilized and ready to do what is necessary to provide the information to the public. And what we're saying is we have to do it together. We have been this road before, back in 2019, when we had an outbreak. The outbreak suggests higher than usual numbers, which is suggesting a higher threat level. However, if we take the necessary precaution by firstly protecting ourselves, by looking around in our environment, working with the health team at the local level, protecting our children, our babies, using nets, covering the drums, and seeing your doctor at your health center where necessary, then I believe we will overcome this process.
The dengue type 2 strain is the most prevalent strain right now. The last time this was predominant was in 2010. What this means is that persons less than 14 are more likely to be affected by this, as they have no memory of the dengue type 2. So they are more susceptible to getting dengue type 2. Dengue type 2 is known to produce a more severe illness. In addition, because persons would have been exposed in 2019 with dengue type 3 or 4, they will now get dengue type 2 as a secondary illness. And secondary dengue is also known to produce a more severe illness. In 2019, our children were affected severely by dengue, and many of them passed. Now, a lot of those deaths was caused by the use of medications such as ibuprofen, diclofenac, and medications called non-steroidal anti-inflammatory drugs to treat fever. These medications either cause bleeding or worsen bleeding. I'm asking all the parents, please consult with your pharmacist. Use only medication, paracetamol or acetaminophen. Use tepid sponge to lower the fever, and if that works, then you don't have to go to medications. But again, I stress, avoid ibuprofen, avoid diclofenac or other non-steroidal anti-inflammatory drugs. For the most part, dengue is a mild illness and can be treated at home. However, persons have to be aware of the warning signs that say that you're going to go on to severe dengue. Severe dengue tends to happen after the fever subsides and you have a persistent of not feeling well, in particular abdominal pain and vomiting. If this happens, then you must seek advice from your doctor